Welcome back to our podcast. I'm Dr. Kesty, and today we're going to be talking about red and green flags when choosing your laser surgeon. We'll go over some things to look out for and some of the tips and tricks of the industry. Lasers are amazing technology, but I want my patients to be safe and informed before they go into any procedure. And that's going to be really important. So if they don't give you that feeling, take a step back and just reevaluate and make sure you feel comfortable with the procedure, the outcomes, and the safety above all else. Let's talk about green flag number one. If a physician or your provider is talking about your skin rather than just the device, that's a really good sign. You want your laser surgeon to be very well aware of all your medical history, any issues you've had with pigmentation in the past, what your goals are, what your skin type is. Even your ethnic background can be very helpful. The more that you can provide to the laser surgeon and make sure that those are all safe, that's going to be definitely important. The consultation should feel personalized to you, your skin goals, and your skin itself. On the converse, the first red flag would be is that one device or one laser can treat everything that you're concerned about. So if somebody says, oh, this one device can treat pigment, scars, brown spots, sun damage, decrease your risk of skin cancer, that's just not possible. We only have certain wavelengths, and every wavelength is designed to do something completely different. So if somebody has one technology that they're saying is going to solve all of your issues, that's likely not the case. An oversimplification of your issues usually means inexperience with lasers and inexperience with that technology. So I would definitely ask about results, especially when it comes to those certain aspects that you're worried about. Let's talk about green flag number two. So that would be a risk assessment. So anytime that a patient comes to me and says, I want this done, what we do is we walk through the procedure. We talk about the many benefits of laser, but the most important thing that needs to be clear is that there are risks. This is an intensive procedure. Any laser surgeon should tell you that there is a risk of hyperpigmentation, prolonged redness, scarring even, and edema that can last for several months. And the other risk is that there's a need for multiple sessions as well. None of these risks should be minimized or brushed off. Although they make up a very small percentage of laser cases, it can happen even in very experienced hands. So yes, it's important to know the risks of going into any procedure. I would say red flag number two is a guaranteed result. If a provider says, oh, this is a guaranteed thing that this is 100% going to be gone, and even in one session, that is definitely a red flag. I would tell patients even after 4 to 6 sessions or one ablative session, you're looking at about a 50 to 70% improvement, depending on kind of what I'm targeting, but somewhere in that percentage is probably a realistic goal. If we get to 100%, great, but realistic goals and expectations are very important as a laser surgeon, and that's what needs to be clear to the patient for sure. So the third green flag that I would bring up is why a provider would choose a certain wavelength and how that matches in safetiness to your skin tone. So as we get darker skin tones or lighter skin tones, we change density, we change laser settings, we change lasers entirely just to make sure that we are completely safe as far as how the melanin or the pigment producing cells in every skin tone is going to react. What we do not want to do is have any kind of complications with pigment afterwards. So knowing what's safe, what lasers are safe, and how to adjust to a differing skin tone type is extremely important when it comes to your laser surgeon. Experience really does matter, especially for medium to darker skin tones. We really need to be cautious about the education about what lasers are safe and how to manipulate settings where we can safely apply certain resurfacing lasers. Red flag number 3 would be if post-care is minimized. So if it's just kind of a sheet of paper that basically gets handed to you after the procedure, that is not enough. You need to be very well versed in how to care for your skin after a laser procedure and have any questions answered prior to going into the procedure. You need to understand that limiting sun exposure, using sunscreen, and even applying Vaseline or any other kind of thick moisturizer afterwards is the key to maintaining the results that we're looking for and accelerate the healing process. If that gets blown over as far as, you can go back to work or do whatever you want to your skin, that's a red flag. And it really needs to be stressed because it's very important after a laser. Okay, so green flag number 4 is somebody who says conservative treatment plans or gives you an option for a conservative treatment plan. Now, obviously, people are going to offer fully ablative lasers, which is not a conservative treatment plan, but they should at least be able to tell you if you didn't have that downtime or if you weren't willing to kind of step into that waterfall, what's the next step down? So if something seems overwhelming to you, you definitely want to ask and reach out. Okay, is there something that I could do to address my concerns or at least part of my concern in a no downtime or a lesser invasive or a lesser intensive procedure? Because conservativeness is very important when it comes to cosmetic results. And especially as it's your first procedure or one of your first procedures, you want to gain trust in that provider. So knowing that they can act conservatively and still give you the desired results is very important. Red flag number 4 is definitely feeling sales pressure. So if you feel like you don't have enough information or they kind of want to have you sign up or do it that day, or you feel like you're getting a better deal if you buy X amount of packages, or even if you have a Groupon or something like that, that is a major red flag. What that means to me is that they want to pressure you into making a decision rather than have your logical mind really think through the risks and benefits of any procedure that you undergo. And that's very important because if they kind of rush the job on that end, you just want to make sure that you have ample time to make the right decision for you. So please, if somebody's pressuring you as a sales and it feels way more like a sales pitch than anything else, please take a step back and reevaluate your options. All right. Green flag number 5 is clear credentialing and oversight. So what does that mean? You can understand where they got trained, what their background is, what their training is, what their experience with lasers are. Those are all really important things. And the next question to ask is who's going to be performing my laser? Usually in our office, it's my sister or I. So we're both board certified dermatologists. We both do lasers every day that we're in the office. And that's really important for patients because you don't want somebody to kind of do the consultation, you make a plan with them, and then you get handed off to somebody else who doesn't really understand your concerns. The other thing is to ask the provider who's going to be manipulating settings or choosing the settings, and that's really important, especially in the med spa culture. You may have a physician who is their oversight, but they are not on site. They are not there to manage any complications that may happen. And that's really important because just in case something does happen, who's going to help you with those complications, number 1. And number 2, in case you're not getting the results that you want, how are you going to manipulate the settings? Who's going to be doing that? Who's going to be looking at the literature and saying, okay, great, we didn't achieve the results with XYZ settings. What are we going to do to change that? And you want to make sure that both of those things are addressed. Red flag number 5, which I kind of bled into in the green flag number 5, but what it is no plan for complications. So you really want to find somebody that just in case one thing that you heard was a risk, what if this happens? What do you do? What have you done? What can I expect as far as follow up, as far as intentional kind of, follow through after the procedure? That's very important because, again, this is a procedure that you're going to undergo. There are risks. And if you were in that very low percentage of patients that do have a complication, what's the oversight? Who's going to be following up with you? What have they done in the past? How successful is that? What's the risk long term for you? Those are all extremely important questions that need to be answered as well. The other thing, as far as oversight and risk, you want to know, is there a way to communicate with somebody from the office or the physician themselves in an after hours way? So, is there a system set up that if after the hours of 9 to 5, can I contact this person if it were an emergency or if I have a question to ask after the procedure? Is there some type of structure where that can, really relieve some of your fears as well? Green flag number 6 is going to be education over upselling. What does that mean? Basically, it is my job to educate a patient on why a particular treatment is what I selected. Now, I need to explain that in plain English. I need to explain it in a way that you can understand, but also using the science and the background of my knowledge to make that clear to you. So if you say, I want my brown spots and I say a laser, then I should be able to tell you exactly what that laser does and why it's the right treatment plan for you. And I think something that goes along with this, that's a huge green flag, is if you come to a provider and you say, I want X, Y, and Z, and they tell you, no, we're not going to do that. That's a really good green flag. If somebody asks me for one procedure, or even if they say, okay, I want this, these are my expectations. And I say, if this is your expectation, then I want you to do another consultation with a plastic surgeon. Most commonly, people are asking me to, change their neck such that they do this and they pinch. And I tell them all the time, if your expectation is that, that's a surgical intervention. My lasers are going to help with skin quality, elasticity, and all the other benefits that lasers have, but it's not going to change as far as kind of 2 inches of thickness of the skin. Red flag number 6 is definitely going to be social media over true medicine. So if there's somebody who is, very forward facing in social media, you really want to look at their before and afters. You want to look at the cases that they have done. You want to see their real time patients and not just the kind of front facing things that you see on social media. A lot of things can be doctored, they can be changed, they can be altered. You want to make sure that they have the education in the background to give you the results that they need. So let's talk about what you can ask your provider to make sure that you are in the right hands. The first question I want you to ask is, why is this laser the right one for my skin? Number 2 question is, what are the realistic risks and expectations for me? Number 3, what happens if I have a reaction or something happens during the procedure? If those can be answered very clearly, then you're likely in good hands. So in conclusion, I want you to understand that there are always risks with lasers, but they are an amazing technology. I want you to find the right laser surgeon for you, and hopefully some of these tips and tricks will help guide you in that direction. All right, so if you're ever unsure, seek a second opinion, ask more questions, and just make sure that you feel completely comfortable before going through with any procedure. If you have any questions, please drop us a DM or send us a message. We'd be happy to answer. Thank you so much for tuning in today.